Welcome to this episode of Nursing Edge Unscripted Saga, where we journey through the history of nursing education using stories that connect the past to the present and then our future as we reimagine our teaching and learning. September is the birth month of Dr. Hildegard Peplau, an imaginative innovator who left an indelible stamp on the theory and practice of psychiatric nursing. Known as the mother of psychiatric nursing, she dedicated her life to the redefinition and expansion of nursing service for psychiatric patients. She pioneered graduate education for clinical specialties in nursing. There is no doubt that she led psychiatric nursing from the confinement of providing custodial care in public mental health hospitals to theory-driven professional practice. Dr. Peplau was born in 1909 in Pennsylvania. In the early 1990s, Dr. Barbara Calloway spent 3 months interviewing Dr. Peplau to learn about her childhood and her remarkable career. Through interviews, Dr. Peplau described her family as patriarchal and strict. Her parents had immigrated from Poland and tried to instill long-held traditional beliefs about women's work. Hildegard identified that she was strong-willed and the family rebel, and early on she made the decision that, unlike her peers, she would pursue an education and a career. After graduating from high school, her parents assumed she would marry, but Hildegard had other ideas and left her home to attend Pottstown Hospital School of Nursing in Pennsylvania. She graduated in 1931. Upon graduation, she again rebelled and did not continue along the traditional path to hospital and private duty nursing. Instead, she found a position as a staff nurse at Bennington College in Vermont and was quickly recognized by the college president as a woman of great intellect. He waived admission requirements and she was accepted as a degree student with a major in psychology. This was a time when very few women of her background and virtually no nurses went to college. After she graduated with a bachelor's degree, World War II was underway, and from 1943 to 1945, she joined the U.S. Army Nurse Corps, serving in England, where she pioneered innovative approaches to treating emotionally scarred soldiers. Following the war, she utilized the GI Bill to seize the opportunity to pursue a master's and doctorate degree at Columbia University Teachers College in New York City, defying again the usual path of many women who returned from the war, married, and started a family. This rebelliousness and refusal to accept the status quo would define her professional life. In 1948, she wrote Interpersonal Relations in Nursing, her seminal work that emphasized the nurse-patient relationship, holding that this relationship was the foundation of not only psychiatric nursing practice, but all nursing practice. Publication took 4 additional years, mainly because Dr. Peplau had authored a scholarly work without a co-authoring physician, which was unheard of for a nurse in the 1950s. At the time, her research and emphasis on the give and take of nurse-client relationships was seen by many as revolutionary. The essence of Dr. Peplau's theory was creation of a shared experience between nurse and client, as opposed to the client passively receiving treatment and the nurse passively acting out doctor's orders. Nurses, she thought, could facilitate this through observation, description, formulation, interpretation, validation, and intervention. Since the publication of Dr. Peplau's work, the interpersonal process has been universally integrated into nursing education and nursing practices throughout the United States and the world. Dr. Peplau was a member of the faculty of the College of Nursing at Rutgers University from 1954 to 1974. At Rutgers, she created the first graduate-level program for the preparation of clinical specialists in psychiatric nursing. She was a prolific writer and was equally well known for her presentation, speeches, and clinical training workshops. During the 1950s and 60s, she conducted summer workshops for nurses throughout the United States, mostly in state psychiatric hospitals, where she taught interpersonal concepts in interviewing techniques, as well as individual, family, and group therapy. Dr. Peplau died in 1999 at the age of 89 at her home in Sherman Oaks, California. She's the only nurse to serve the American Nurses Association as executive director and later as president. In 1994, the American Academy of Nursing honored her as a living legend. Dr. Peplau truly changed the practice of nursing. Her model is now a core principle taught in every nursing program. For every nurse who entered the profession in the 1960s and beyond, the concept that nurses are therapeutic agents who build trusting relationships with patients is a core belief. As a result, Dr. Hildegard Peplau helped to elevate nursing from a custodial role to its full professional status. She succeeded in changing the way nurses perceive their role and how all nurses understand their ethical responsibility to be fully present with patients and their families. For that, we are all in her debt. And so the saga continues. And may our saga continue as we bring to a close this episode of Nursing Edge Unscripted, Saga. Thank you for joining us. And remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.